when people experience really hard things, right? And I think trauma has become this hot button word, but truly not only is our psychological health part of our physical health, but they're all interact. And so our body stores up our trauma. And so we all need to be heard and loved to get well in both of those areas.
Welcome to Restoring Hope, a podcast of the Wyoming Rescue Mission. I'm Darren Adwell-Palker, and joining me today is Kass Lesco. Kass is the mental health coordinator at the Wyoming Rescue Mission. Kass, thanks for joining us today.
Yeah, you're welcome. Thanks for having me.
Yeah, this has been a dream, I know, of the mission for a long time to add the piece of mental health to the overall goal of the mission to help people grow in every aspect of their life. Can you talk to us about why it's so important that we have that piece? And I know that you were one of the first people that were brought on in this in 2023.
Yeah, so I came on as an intern. I started my MSW program and really just started praying about where to go. My internship in my bachelor's program was not necessarily where I wanted to be, so I really wanted to follow God's heart on that, and it was important to me that faith took the front seat in everything. So I really kept feeling like rescue mission just kept coming to mind. And so when I came down to the rescue mission, I found out that having an intern had been like a 10-year dream of theirs. And so it lined up really well. They had one counselor here. It was brand new. It was the first counselor that they'd had. And as I started doing research and seeing how much mental health played into just being unhoused and the co-occurring, like, it's not just like, oh, people are homeless. There's so many other things that cause it, right? There's co-occurring issues like substance use disorders or severe mental illness. And oftentimes when you have a substance use disorder, you may also have a mental health condition. And so I actually brought this is from 2021 from NAMI, which is the National Alliance on Mental Health. But 1 in 4 people with a serious mental illness, which is something like bipolar 1 or schizophrenia or like major depression with psychotic features, something like that, they've been arrested by the police at some point in their lifetime, leading to over 2 million jail bookings of people with a serious mental illness each year. 2 in 5 adults in jail or prison have a history of mental illness, which is incredible.
Almost half.
Yeah. 7 in 10 youth in the juvenile justice system have a mental health condition. And right, we have children that come to the mission. And so if you think about, right, maybe their mom is having a mental health issue as well. And we know that mental illness can also run in families. And so we need to consider these things. Oh, I turned it upside down. 1 in 5 U.S. adults experience a mental illness each year. And in a state with our small population, right, we have under 600,000 people, but 88,000 adults in Wyoming have a mental health condition.
Wow. And how does the population that finds its way to the mission kind of talk about particularly the challenges there? You mentioned that sort of the co-occurring issues sort of stacked on top of each other, but help our listeners understand sort of the particular challenges that we face maybe in need, but also access to mental health services.
So for those of us that maybe have an income, right, and insurance, we can go see a doctor and we can get meds, right? We might not like our co-pays, but we can get meds.
It's accessible.
Yeah, it's much more accessible. We have a way to pay for those things. For people that come to the mission, they may not have insurance, or their insurance might not cover things. They may not have a pay source, so like a source of income. Their medications may cost too much. They may not be connected to a doctor. On top of that, when we talk about mental health, oftentimes it's not garden variety anxiety and depression. And I don't want to sound minimizing, but it's not like what we're looking at when like anxiety and depression are important and we need to treat them. But oftentimes we're looking at things like schizophrenia, bipolar 1, and then we add in oftentimes substance use disorders. And these are often things that are outside of this person's control. And so when they don't have access to treatment, or they don't, right, if let's say that I have schizophrenia and I've not been taking my meds and I'm having so many delusions. there's so many voices. That is going to impede my ability to remember to take my meds, to know what day it is, to go see a doctor. And I might drink to deal with those symptoms because it shuts things down. And then how am I going to keep a job or go get a job, right? And these are oftentimes not a choice, right? They're a barrier.
Yeah. And I would think that the prevailing stereotype out in the community at large is that, oh, people are unhoused because they just choose it.
Yeah.
They want to be. So help us understand, while there may be cases, and I've talked to people, I did work in inner city Chicago and Los Angeles, and there are people that are like, this is kind of the life I've chosen. I would say that's a minority.
Absolutely.
Help us understand again how mental health plays into the reality for many people being unhoused.
So I would say there are people that choose to be homeless, right? They prefer that freedom, but I would say it is a small percentage. I think the larger reality is that oftentimes things stack on top of each other, right? So it's like I have these things that I've gotten in the way. And so all of a sudden I don't know how to pay my rent. I don't know how to go and get this help. I don't know how to help myself. And I really don't have the support system that I need, or people are overwhelmed. And it's not pull yourself up by your bootstraps, right?
If you don't have boots.
Yeah, if you don't have boots, or maybe I lost my boots.
Right.
Or maybe I don't even know where the boots are. Or maybe I might not even know who I am this day, right? There just really is that. And so a lot of times we need help.
Yeah.
And we need help to get those things. We need help getting connected with resources.
Right.
And I think the reality is that when we have the perspective of, well, they are just like that and they just need to go get a job, we don't realize how many barriers that there is to, how do I apply for jobs if I'm having so many mental health issues, or if I've had so much loss? I've lost my house. I've maybe lost custody of my children, or I don't have any family to help me. That's very true for a lot of people that come here. Maybe they're transient. Maybe they have been for a long time. Maybe for whatever reason, showers are a really scary thing, right? Think of all of this. Try to go have a job interview. If you are in a psychotic episode, you don't have access to meds, you haven't showered in a week because you don't know what day it is.
As you're describing all this, it makes me think about how important it is to have someone like you who's trained, has a license in mental health, and is able to help people, because in the past, people came and we did the best that we could, but now there's more of this specialization. And also we have a whole network of resources, organizations in the community. So can you talk about how we work across the community to help people get the help that they need? You mentioned medications, other levels of care, psychiatrists perhaps. So talk to us about that.
So since I've been there, we've been able to build up a better relationship with Central Wyoming Counseling Center. We have a med provider that comes every week or every other week for half a day, and she sees some of the guests on site, and she does med provision. I also will submit things like med donation applications. I have a good working relationship because I attend the situation table, which is basically an MDT meeting, so a multidisciplinary team meeting of different organizations. And I've been able to build up relationships with CWCC and their new executive director, and WBI, and their admissions team, and have this ongoing relationship. And so when I make referrals, it helps them maybe deal with some of the more high acuity cases that we have, and also just help with that referral process where communication can happen. Because if you have good communication with different organizations in the city, even if we have people that we're like, maybe I can't counsel them, or maybe they need like more wraparound services, I can definitely get them in touch with others who can. And CWCC is the gatekeeper for behavioral health, so they can get funding from the state, and then they can refer out.
Sure. So the partnerships are valuable because we can't handle every issue.
Right.
We want to help provide and point people in that direction.
Yeah.
What would you say are some of the biggest challenges? People come in literally off the street in whatever condition they are. We give them a warm bed. We give them 3 warm meals a day. We walk with them. But people that have gone through levels of trauma that we might not be able to comprehend, how do you start to build trust in those cases? How do you create that environment or the mission in general for people to feel safe enough to open up and start walking a path of healing?
I think the biggest thing is you want to be kind and you want to meet them where they're at. I think of in Matthew 9, right, when the woman reaches out and touches Jesus's robe, right? And in that day and age, women and lepers were like, number one, you don't touch a man, and if a leper touches you, you're unclean.
Plus, she had an ongoing illness.
She was unclean, right? In our day and age, people with severe mental illness and people who are homeless are very stigmatized like that. Unfortunately. And I think that we need to treat them like that. He turned around and he felt the power leave him, but instead he says, daughter, your faith has saved you, right? And I think that we need to look at each person like that. And we might not be a proper placement, but even when we're setting boundaries or when we're saying, hey, we need to make this referral, I think that we need to have that heart of compassion, right? And sometimes it is really hard because you find a lot of defensiveness. People oftentimes have been treated so poorly, or they've been dropped by their family members, or they've been put down, or right. Oftentimes our trauma makes us want to hide.
Yeah.
And we do feel like a leper, or we do feel unclean.
Yeah.
And so if we can treat people with compassion, to the best of our ability on any given day, right? And turn around and instead of condemning or going, oh my gosh, you can't be here. Hey, let's find somewhere where you can go. Or how can we help you? Or what do you need?
I love that story, and it reminds me of a situation. So I'm not a trained counselor, but I was a pastor for 25 years. And so learning to listen to people. We go out as a team once a week to connect with people in the community that might be unhoused or might be just to try to meet them where they're at. And there was a situation where somebody got pretty elevated, and it took a while, but I was able to listen and just stay connected and listen to his story. And by the time it got down to it, there was a real tenderness underneath it. And it just reminded me that we all need to be heard.
Yeah.
And it's easy to kind of write somebody off based on how they look or where they're at. And I think as human beings, we need somebody to hear us. And maybe that if we can broaden the conversation for a little bit to our listeners about one, we want to help people understand the work we do at the mission, why it matters, why having people like yourself, Kass, on staff that are specialized in this. But maybe we can seem that only the trained professionals can listen to somebody. So maybe invite us into this conversation about what does it look like for us to be more present, listening to our friends and our family, to be maybe more aware of mental health issues in our own circles and in our community. How can we be better prepared to just walk with people, whoever we may be?
Yeah, so I think the biggest thing is that being heard is a human need, right? And regardless of whatever our mess is, right, their boundaries are important, but we have to really understand that each one of us needs to be heard, and each one of us that is a basic need, is to be heard and to be loved and to be seen. And so if we have family members that are struggling with mental health, or even if we are, number one, it's not a shameful thing, right? And if people want to hide, and if people, obviously we can't make somebody, but it is not something where it has to be
stigmatized.
Treated as though they're the leper, or treated as though they're the one who needs to be shunned, right? And I know that especially in a state where we have such a high suicide rate, we really need to be aware of the fact that I know that you and I had previously discussed The Body Keeps the Score. And so,
which is a book
about trauma, right? And so when people experience really hard things, right? And I think trauma has become this hot button word, but truly not only is our psychological health part of our physical health, but they all interact. And so our body stores up our trauma. And so we all need to be heard and loved to get well in both of those areas.
this might be a little bit off topic, but why does the body store trauma? Just if to understand that a little better.
So the brain is an organ, right?
Yeah.
And it's connected to our nervous system, right? So when trauma happens to us, it happens to our whole being,
Okay.
right? And so when we think of like, okay, my emotions, right, that kind of lives in like our soul, if you will, but our nervous system experiences it, right? And so our nervous system affects every single hormonal, every muscular system, all of our digestive system. And so when we experience trauma, and much of the people that we see at the mission, and a lot of people with mental health conditions, they've experienced some type of ongoing trauma, maybe PTSD, complex PTSD or existing, and it throws off our HPA axis. So that's our hypothalamus and pituitary. Those are in our brain, and our adrenals that sit on top of our kidneys. And it's because our cortisol is completely out of whack, right? And so our whole hormone system is out of whack. And if our hormone system is out of whack, nothing is going to work right. And eventually, if all of that goes untreated, right, we're going to start having chronic health conditions. So mental health is very much a part of physical health, like our whole body.
Right.
And just like you would want to treat diabetes, you want to treat mental health.
Right. And that's why we can't just, it's not just a one method approach. It's not just pray more or read your Bible. At the mission, we want to treat the whole person, right? And so kind of looking at like Maslow's hierarchy of needs, at the base of the pyramid is food, shelter, safety, clothing, but then it moves into sort of the emotional and social safety that allows people, and in a previous podcast episode, we had Dave Matthews talking about the journey that our guests take through the discipleship program, and how looking at their stories and rewiring their connection with their identity and their self-perception. So it sounds like all this takes time.
It does. It takes a lot of time. There was this study on I can't remember if it was cocaine or heroin, but it was like rat park. Yeah, rat park.
Yeah.
And what was amazing was that the rats who were isolated, right, they continued to go back to the substance. But the rats who were like in basically rat paradise, right, they didn't. Some of them might have used occasionally.
Right. And these were rats that were previously hooked on a substance.
Yeah.
When they had access to all the spinning wheels and the tunnels in their environment.
But when we have love and belonging, we start to heal.
It's good. Yeah.
Right. And I think that that's what's amazing about the discipleship program, because the way that case management is done, and I think that that's where the mental health piece comes in. It does add that love and belonging piece. Right. And also even in the discipleship house, where it's a whole bunch of people that are really just trying to figure out how to live differently. There is also this, how do we support and how do we train you to think and live differently and to love one another? And I think that like when we, even on a bigger scale, how do we help you interact with your family in a different way? How do we help restore some family connections?
That is in a really cool TED Talk, the whole rat park thing. And if people Google, I think the key line from it is the opposite of addiction is not sobriety, it's connection. And that connection is really what the human heart needs. And we talk about, from the first pages of Scripture, we see the disconnection that happens between God, ourselves, others, creation, and community. And so at the mission, one of the things I love is that it's holistic. And as you mentioned, like it's multi-level all the time, right? So it starts with food and shelter, but mental health is a part of that, helping people get access to the medical care, the medications that they need, relationships. So I would imagine being in your role, this can get heavy at times. How do you just personally process and try to stay healthy in the midst of dealing with, because these are heavy situations?
Yeah, it's been a sharp learning curve for sure, because I came as an intern and then they hired me right out of school. So I did all of my provisional hours here, and then I
sink or swim.
Yeah, and then I just got my license. A lot of prayer, and I do have a good support system. I feel definitely at the mission, but I do feel that like I have some friends that are also social workers that are believers that love me very much, and learning how to practice self-care. So, deep breathing, vagus nerve stuff, walking, exercise that feels restorative, that isn't hard on my body, taking care of my physical health. and also managing, because I also have an extensive trauma background, and so being very careful about that. Vicarious trauma is a real thing, and that has been something that I've had to learn about.
Which means that
Right, where when people are telling you their traumatic stories, you can pick it up and be traumatized, actually. And that is something that I've had to learn about being there. It's been interesting, but I've gotten much better at being able to separate things and compartmentalize them. And I have my own counselor. My own counselor was the first one who was like, marijuana is not the gateway drug. Trauma is.
Wow.
And that really helps me always put things in perspective. And when I feel, because you can get a little bit jaded at times.
Sure.
And so when I start noticing that.
As an indicator. So it's a light on the dashboard.
It's like that little yellow light. Like, hey, we need to do something different. And so I try to do things that I enjoy. I have 2 dogs and 2 cats, and I love my dogs. And be really consistent about, petting my dogs.
Sure.
And then I try to have really good boundaries of I'm trying not to check emails after work.
Yeah.
Be connected all the time.
And these sound like just good life skills. My wife's a mental health professional. She's a licensed professional counselor, and often says that a lot of the things, and this is not to minimize like what we talked about, the need for at times medication or deeper interventions, but said a lot of the things that help us to stay healthy are actually free and relatively accessible. You know, going on a walk, connecting with friends, taking a nap, getting some exercise, journaling, reading, studying, praying, whatever. There are things that are at our disposal. I know you teach classes in the discipleship program. I also teach a class. And one of the things that I help our guests do is create a yes list, right? So it's easy to just kind of focus on the no's. I'm not going to do this. I'm not going to take this substance. But we also talk about what are the yeses, right? Because, in the garden in Genesis, God said there's many fruit trees. Like you can all of these, make a smoothie, like put it all, combine it, right? And there are some no's, right? There are some things that are off limits, but the yeses, I don't know that we often put a lot of thought into what are the things that build me up. And so we want again, to have this be a conversation where our listeners can take away something from this. And so that's something that I hope they can hear, is that we all have challenges. We all have, because we live in a human and broken world, we all carry scars in trauma, but we all need some basic things. So we need relationship, we need meaning and purpose, connection. As the community safety, as the community engagement coordinator, we need a place to serve. We need an outlet to realize that life's not just about me, but it's about serving. So we invite our community to come be a part of this, to serve a meal. What are some other things that you might say to leave with our listeners, just by way of encouragement in their lives, but also ways to maybe connect and partner and be a part of the work that's happening at the Rescue Mission?
Yeah, I think definitely educating ourselves on mental health, just and that, right, you can go to the National Alliance on Mental Illness, which is at NAMI.org, and it's just a great resource and really easy to digest. And I think donating can be really helpful because it helps fund these things. It helps, and that's what we run on. And I think also just being really mindful about like any types of books. So The Body Keeps the Score by Dr. Bessel van der Kolk is a really good one. You can even listen to it on audiobook. There's lots of other good things on mental health. And then I think maybe talking about mental health more. I know that it can be really stigmatized. And then educating yourself on homelessness, because there's some great resources out there. There's great resources on like even on homelessness in Wyoming. I know that there's statistics that come out from the Natrona County Health Trust, I think it is, every year. I think that they're the one that...
The point in time homeless count?
Yes. And I know Alaska has similar statistics to us. So Alaska would be another state to look at, because I think that we are neck and neck with like homelessness and alcohol abuse.
Suicide.
Yes.
These northern colder states are... disproportionately impacted by suicide.
Yeah, and then, I mean, just being aware of some of the policies that impact some of our disadvantaged. I think, not to get political, but there are policies that maybe make it harder for people to access what they need, or maybe don't benefit them as much.
And I'm hearing you say on that we're all part of a community.
Yes.
And sometimes we can see policies or candidates just through the lens of what are they going to do for me?
Yes.
And if we can invite them into what does this do for us?
Yes.
And particularly the most vulnerable. I think about when we say the Our Father, the prayer that Jesus taught us to pray, it's in the first person plural, right? Our Father, give us this day our daily bread. And it's kind of like, in the Pledge of Allegiance with liberty and justice for all. It's not me, right? And it's easy to kind of take that, well, if I'm good and my family's good, then we're good. And I think part of our mission at the Rescue Mission is to help us see that a healthy, thriving community involves all of us doing what we can do to help those that are in need. And in this case, so
there's a podcast about that. I can't remember the name of it right now, but I listened to it when I was in school, and they discuss that. It's really, they do this thing in Canada, and it's really about how when the whole community is healthier, we're all healthier.
Yeah, kind of reminds me of Jesus' idea of the kingdom of God, which is this reality, your kingdom come on earth as it is in heaven. And so seeing wholeness and healing come out of brokenness. So thank you for the work that you do in that and stepping into that. I know that's not necessarily for everyone. It's a calling. So we want to encourage our listeners to pray for you, Kass, and for our team, our mental health team especially, because dealing with some of the hard cases, and yet to realize that all of us together in our community can be a part of this. One of the ways is just to come down to the Rescue Mission, schedule a tour with us. We love to show people around and kind of see how the Rescue Mission works and how it starts with a meal and it starts with shelter. But it involves case management and counseling and taking those next steps. And so thank you for what you do and who you are in our community, for being willing to jump into that, to help be a healer. It reminds me of Henry Nouwen was a Catholic priest, and he had a book called The Wounded Healer. And the idea is that in the same way that it says in Isaiah, by his wounds we are healed, that we all have wounds, and sometimes we think, well, I've got to get to a certain level before I can help someone else. If we realize, like, actually our wounds can be in a healthy way and in a boundary, actually a point of healing and connection with other people, that compassion that you mentioned
for sure.
before.
And I would say, as I've been doing this work, it's amazing how much I learn from those that are sitting across from me, right? And how much the disciples in the discipleship program have taught me.
Right.
And how much just allowing myself to be open to learn from them actually encourages my own healing. Just because watching them grow and watching them overcome.
We're all on a path of healing.
Yeah.
None of us can do it alone.
Yeah.
And we need each other. And so thank you again for doing what you do. Thank you to our listeners for joining in and supporting us, and some of the work that is happening that people might not know that takes place on a daily basis comes through you in your office. So thank you so much.
Thank you.
Well, thank you for joining us today for another episode of Hope Restored. We hope that you've been encouraged today. Continue to follow along and check out our website, wyomission.org, where you can learn more about the work of the Wyoming Rescue Mission. To become a part of it, we all have an important part to play.